Welcome to this month's Health and Communities Committee. We're going to kick off and I'm going to ask Barry to read out the notice and summons the meetings and take the attendance, please. Barry.
Thank you, Chair. Members, you're hereby summoned to attend the meeting of the Health and Community Committee, which would be a hybrid meeting conducted remotely via WebEx and physically in the Council Chambers, Strabane on Thursday, the 15th of February, 2024 at 4 p.m. Roll call. Alderman Nairi McMorris. Alderman Janice Montgomery. Councillor Jason
Yes,
Barr.
online, sorry.
Hereby.
Councillor Paul Boggs.
And
Councillor Caitlin Deany.
And
Councillor
Shaw.
Caroline Devine.
And Shaw.
Councillor Gary Donnelly. Councillor Alex Duffy. Councillor Sandra Duffy. Councillor Conor Heaney. Councillor Aisling Hutton. Councillor Catherine McDade. Councillor Lillian Sinoy Barr.
Here.
And Councillor Brian Tierney.
Here. Okay, members, item number 3 is the broadcasting statement. I would like to remind everyone present at this meeting in the Strabane Council Chamber or in attendance remotely that this meeting will be broadcast live to the internet and will be capable of repeated viewing. This broadcast may be terminated or suspended in accordance with Council's protocol. Due to your attendance at this meeting, you are consenting to being filmed and to the use and storage of those images for broadcasting or training purposes and for the purpose of keeping historical records and making those records available to the public. Members and approved speakers are reminded to only have their mics and cameras on while speaking at the meeting and to use of chat facility to highlight a request to speak. A copy of the Council privacy notice may be found on the Council website at derrystrabane.com. Members, item number 4 is declaration of members' interest. But before we move on to that, just to remind people of the email that was received by all members yesterday from Sharon Maxwell in relation to the use of your mic when you're speaking at the committee. If we can all use it and speak clearly. There was as usual, be aware there was a concern from a member of the public. So we can just remember that when we're speaking, please. Item 4 is declaration of members' interests. They can be made now or as we step through the meeting. Anybody in the chamber or online? No. Okay. Members, item number 5 is our deputation, and we have in the council chamber Deirdre Morrow, the community engagement officer for the Dogs Trust NI, and we also have joining us online Lucy McCune, who's the public affairs officer as well. So you're very welcome. What we normally do is give 10 minutes presentation and then questions and answers then from the floor. So Deirdre, I understand that you're going to lead and Lucy will support online. So over to yourself. You're very welcome. Thank you.
Perfect. Thank you so much for having me here today. So just as the chairman's already explained, my name is Deirdre Morrow. I am Community Engagement Officer at Dogs Trust. So today I'm here to talk to you about the Walk This Way intervention. So next slide, please. So our Walk This Way intervention was first developed in 2017 alongside Keep Britain Tidy. And basically it was just in recognition that fouling is a really common issue in all public spaces all over the UK. Research showed that poor bin infrastructure was a leading factor in dog fouling. So Walk This Way asked participating local authorities to add more bins to their sites also if that is required. Just one more click, please. Thank you. The project involves creating dog-friendly walking routes in public spaces. These can be in a variety of spaces, whichever the local council prefers. So that could be urban areas, parks, nature reserves, beaches. And it involves colourful route marker guides and walking routes of different lengths. And lots of bins, which provides dog owners the opportunity to correctly dispose of their dog waste. Basically, it's a nudge-style intervention. So the aims are met while the focus is not entirely on fouling, unlike other anti-fouling campaigns and interventions. Next slide, please. So who takes part in this intervention? So this intervention is aimed at local authorities using the intervention on their own council-owned public spaces. So again, such as beaches, parks, coastal paths and urban areas. So this includes putting up our materials. So you'll have your welcome signs, your route markers and your bin stickers, and monitoring the progress if desired. Although the local authorities will be independently delivering the intervention, our community engagement team will be key in administering all communications before the intervention starts. Next slide, please. Okay. So local authorities themselves will be responsible for purchasing and ordering the materials, the Walk This Way branded materials, and delivering the interventions on whatever sites they have chosen. They will deliver these interventions independently. However, Dogs Trust are always there to guide and support. We will give all our local authorities a complete free guide which walks our partners through how to order the materials, how to get their sites ready, and how to monitor the effectiveness of the intervention as well. And the agency that we use is Carbon Creative. So the ordering process will be done through them via an inquiry form. Unlike previous years, monitoring is no longer a requirement, but is just an optional tool for local authorities. Next slide, please. So we're going to have a look at some of our materials. So just a little brief overview of the materials before we actually look at them graphically. So we have a welcome sign. So this is going to be a display sign including a site map of the specific site in each local authority. And it shows all the routes and route markers and ensuring owners that a bin is never too far away. And we also have our directional route markers around the sites. So these will be attachable route markers which will direct dog owners around the site and let them know how far bins are away. And then we have also our bin stickers and these will be put on every single bin just to remind them that every bin is possible to dispose of dog waste and they don't have to look for the red bin specifically. So just a guide to maybe the amount or length of routes or amount of installation materials that you'd need. So about a 2 kilometre route, what we would describe as a short route. So you'd roughly need around 10 route markers and 5 bin stickers. Moving on to a 4 kilometre route, you'd need around 20 route markers and 10 bin stickers. And again, to an extra long route, which is around 8 kilometres, about 40 route markers and 20 bin stickers. Next slide, please. Thank you. So this is our graphics of our intervention materials. So first you can see there are the route markers. Now these have adhesive arrows. In previous years, you would have had to order these route markers with an arrow pointing forward or downwards, left or right. The feedback we got from councils was absolutely brilliant. And they said that, you know, this wasn't always conventional, I can't say that word, conventional the way the land lies. So we've made them adhesive stickers now, so they can be pointed anyway off to an angle. The middle picture is an example of our welcome sign. Now this is an example from England, Birkenhead Park. So the councils would send Carbon Creative a map of their designated area, and then they would create a lovely interactive map. They'll make it as close to the real thing as possible. So there'll be, if there's a children's play park, if there's forested areas, if there's a lake, that'll all be added in. And the most important thing is it will show all the bins in the area and it'll show all the routes as well. And you'll be able to add your council logo to that as well. And then lastly, we have our bin stickers. So these stay the same, they don't change, and they will go on every bin with that logo on it. So next slide, please. So just a little step-by-step guide on how the intervention would run. So basically, the local authority would receive a promotional email from their regional CEO. So for Darien Strabane Council, the regional community engagement officer would be myself. So they'll receive an email from me. If they'd then like to go ahead with the intervention, they'd email our community engagement team to apply for the Walk This Way guide and content. Furthermore, then they'd order the installation materials from Carbon Creative and then receive their materials, set up the intervention and deliver the Walk This Way intervention. Next slide, please. So we'll just break this down a little bit more. So like I said, number one, you'd be receiving a promotional email from your regional CEO. And this would include an infographic image that contains a brief description of the intervention and a PDF, just detailing it in a little bit more information. Next slide, please. So as with step 2, if local councils would like to go ahead, then they would then apply for the Walk This Way. Our community education and engagement team would then send them an email. This would be a bit more detailed. So there would be a Walk This Way guide. There would also be a press release, also social media assets, as well as a monitoring template and perception survey questions. Again, the councils can run this in whatever way they like. So they mightn't choose to use perception survey questions, but we have everything there in case they do need it. Next slide, please. And then step 3 involves local authorities ordering the intervention materials using the below inquiry form from Carbon Creative. So this will just be directly to Carbon Creative. It's unlikely that Dogs Trust will be needed at this stage, but again, we're always there to help and support if need be. So the local authorities will be able to choose the amount of welcome signs. So that's obviously dependent if there's one entry into the area that they've chosen, say a park, or if there's a couple of different entries, how many route markers and bin stickers that they think they'll need as well. And that will generate an order from Carbon Creative. Next slide, please. And then with step 4, the local authority would set up the installation materials, and when the intervention is in place, they'll be able to run it effectively. Again, who's involved in this part? It is the local authority will be running it independently. Dogs Trust will unlikely to be needed at this stage, but again, we're also always there to support if needed. Next slide, please. So this is just a few cost examples of the materials as well. So they do come in a couple of different materials. So the welcome sign comes in Corex material, and again they're supplied with cable ties and your hose already drilled into the corners for £9.30 each. Dye bond material, which is a bit of a harder aluminium material, they're £47.84 each. And then again dye bond material, but supplied with like challengings and clips and screw bands is £62 each. These are all always also available in A1 size. And remember, they will be very specific to your site with that beautiful map on it and your council logo as well. So again, our route markers come in the 2 different materials. As you see there, the more that you order of these materials, the cost of each one goes down. And again, same with bin stickers, they're self-adhesive, so you can stick them on if you even wanted to stick them on all sides of the bin as well. But again, they'll go down in price the more that you order as well. Thank you. So thank you for your time today. If you have any more questions, please go ahead.
Thank you very much. Deirdre, just before we do open it to the floor, I'm going to check online if there's anything that Lucy would like to add, or if she's happy enough.
Hi, thank you for adding me in. Just to say thank you, Deirdre. Really just to say that in general, as Dogs Trust, we're very keen to be working with the councils, and if there's anything else that we can support on in terms of responsible dog ownership or anything like that, please do let us know. But we hope that the Walk This Way intervention could be of good use and just help to develop that relationship. That's really everything, but thank you.
Okay, thank you, both Deirdre and Lucy. I'm going to open it to the floor now. Members, first indicated speakers, Councillor Sina Bard, Lillian.
Thank you, Chair, and thank you, Deirdre and Lucy online for coming to speak to us today. I've really enjoyed your presentation, and I had time to go through it last night, so I was very happy to see some of the discussions that we had when we met in Como being presented here today. And I have to say, I was delighted to propose your invitation here today because I realize and acknowledge the importance of working together with tackling dog falling. It's an issue that remains a massive issue within our community, where every councillor here has received phone calls and emails from the public asking us to deal with this issue. And in November, I proposed that council collaborate with your team to launch a comprehensive educational campaign promoting responsible dog ownership. And I do know that you already do that in a small scale within community organizations and in schools. And I was just really interested after speaking with yourselves, you had mentioned that the Walk This Way campaign had a significant improvement with, I think it was, and correct me if I'm wrong, 33% decrease in dog falling within the city and district. And I do know about the We Are Watching You campaign, which is part of the Keep Britain Tidy, and it is implemented in residential areas. Am I right in saying the Walk This Way campaign is in public places, as you have mentioned, but the You Are Watching You campaign is in residential areas? And I wonder what is the difference between the two, because if the statistics are correct, our Keep Britain Tidy reports is that there is a 75% decrease on Walk This Way campaign is 33%, and then the one for We Are Watching You campaign is 75% decrease. So I wonder what's the difference in that, and also if it is because of the campaign behind it, the educational campaign behind it to tackle dog falling within the community, or is it because of the striking images that are a bit scary on the other one? So I just want to understand your perspective on what's the difference between the two campaigns, where one looks very effective with a higher, although this one is very effective also, but the percentage looks a bit different.
Thank you for your question, Lillian. Yes, they are two totally different campaigns. The We Are Watching one was, like I said, was run by Keep Britain Tidy, so Dogs Trust didn't have any involvement in that. And the Walk This Way one is our strategy campaign. I think, as I mentioned previously, it is more of a nudge campaign, rather the Keeping Britain Tidy is one was people knew that it was specifically about dog filing, and where this one is, following route markers, and it's more of a nudge style campaign, and people are nearly encouraged to pick up their dog filing without actually feeling like they're being forced to do it. We did have really good results from it 2 years ago in 2022. We ran it over 3 council areas and 4 sites. Overall, the percentage in Northern Ireland, there was a decrease in 49.75% of dog filing, but some sites had, significantly higher rates. I think was it Lurgan Park had 71% decrease in dog filing, and Mid-Ulster's Lochfey had 85% decrease in dog filing. So it did vary over the 4 sites, but the Walk This Way campaign still gets really high results, so it does.
Just come in. And is there a way we can integrate both campaigns together, or maybe extend the Walk This Way campaign to residential areas?
Yep. I'm just going to come to Councillor Hutton, and then we'll come back and answer that question, because we've got more speakers just on this, all right? So Councillor Hutton, thank you.
Thank you, Deirdre and Lucy, for the presentation. And can I say that just looking at this last night when I was reading through the report, I love the imagery. It's very child friendly. And I think that when people do take their dogs out a walk, the children are going with them. And this is encouraging children as well to be responsible with their dogs. I just love the image. I think it's just really striking and very child friendly. I'll just have to concur with Lillian, what Lillian was saying. We are inundated with reports from residents, families about dog fouling on our streets in residential communities. And I suppose we're working very closely with Seamus and the team, trying to alleviate some of that, working with residents, putting signage up, offering that support. And to me, this appears to be something that's going to be within a park, and I do think it would be very beneficial. I don't see this in any parks that I do be in, so maybe sometimes people think there's no signage, there's no one watching, so we'll just let the dog foul here. So I do welcome it, and I think it would be really, really successful. But I also would be interested to see how this would work on our streets, and how maybe Dog Trust can provide something like this, or even something along the lines of residential areas, highly built up areas where people are out walking, where children play especially, and in green areas. But the We Are Watching You campaign was a motion by Lillian a way back, and it is to see the difference between the two, and if the both of them could work together. We are committed here to providing safe and clean communities. And this is a brilliant start to doing that, and I really do welcome it. But I would be interested to see as well how this could work and sort of city centre residential housing estates as well. But thank you very much and congratulations. It's a lovely initiative.
Thank you, Councillor Hutton. Online, Alderman McMorris. And Alderman McMorris, your attendance has been recorded as well. So if you want to go ahead there now.
Yeah, thanks, Chair. Just to concur with what everybody else is saying, I just really love this here strategy that you have in order to tackle dog fouling. It's really, really good, and it's really, really welcomed. As everybody else has said, dog fouling is a blight in all of our communities, and you know, it's good to see people coming out with strategies in order to tackle it. And not only that there, but you know, to create walkways, you know, specifically for dogs, and the imagery and around that. You know, it can only do what it's meant to do, and it's promoting responsible dog ownership. But really, really welcome it. And I was down in the dog pounds in our own city there the other day. And it's just, I'm really glad that council's taken on this initiative to work along with the Dog Trust. I know they have been working with them, and I was kind of really impressed with the dog pound the other day, and the work that the dog wardens are doing. Do you know what I mean? And it really gave me an education and around the background stuff that goes on. So well done, thank you.
Thank you, Alderman McMorris. And Deirdre, if you want to, there's some questions on there. If you want to tackle them, and then we've another couple of speakers for you then after that as well. So if you want to take them first three, work away.
Just have to try and remember what everyone said now. So just in yes, relation to our signage and everything, it is, you know, it is meant to be, it is designed to be eye-catching, and I think that is exactly what it does. So then that's great. In relation to possibly merging the two campaigns together, that would be something that would have to be discussed higher up. As I said, there were two completely different campaigns, and we were never involved in the We Are Watching You campaign, so that would have to be discussed. However, we have worked with Britain's Got Tidy before, so it would be never say never. Thank you.
Okay, thank you. Councillor McDade.
Thank you, Chair, and thanks Deirdre and Lucy for coming in and your presentation, and thanks to Lillian for proposing for you to come on as well. I suppose what Aisling said actually is what I actually didn't think of that. It is so child friendly, and I have a dog and I have 3 young weans, so I should have thought of it and I didn't. So that's great in that respect. I'm just thinking, whenever you were giving your presentation, I'm thinking of where I think it should go. And I guarantee that everybody here is thinking where it should go and like how much that would cost then to have it in every single kind of area that we're talking about. So what Councillor Hutton had said there about the more kind of built up areas as well, is there another kind of, you know, this is a great campaign, but is there another campaign as well that you could have maybe even just stickers on bins? Do you know, I'm just thinking rather than having the map and the signs and all the rest of it, but is there another kind of version of it that you could have everywhere, like in the town, in the streets, everywhere, the stickers on bins that you can put your poo where you want, as long as it's in a bin? Thank you.
We don't have another version of the intervention, but I suppose it would be up to local authorities if they decide that they wanted to order more bin stickers and put them on their bins in more urban areas. We actually, Derry and Strabane was the first council in 2022 to trial this intervention in an urban area. So that has been done. It was done in Strabane town and in Derry, in the Derry city centre as well. So it was with quite good results as well. So thank you.
Thank you. Alderman Hussey online.
Thank you for the presentation. It's a question really to officers rather than to the presentation. Is that message when you put any bin will do, does that fit in with, you know, the message that we put out in council that really it should be going into the dog poo bin as opposed to maybe the ordinary rubbish bin or you know, that is around?
Thank you for that, Alderman Hussey. Councillor Cusack online as well.
Thank you, Chair. And I'm not a member of the committee, but this is a subject that I'm very, very interested in and have tried to work on for more or less 10 years now. Just a quick question. Thanks for the presentation, but a quick question. How do you actually measure the success of the campaign? Is it visually, or would there be like the contents of the bins? And secondly, to the officers, I know that previously and in some areas, park areas such as the Bay Road, we had a similar sort of imagery, footprints going towards the nearest bin, etc. And I was just wondering how effective did that campaign, which was, you know, council imagined and council led, how effective was that campaign? And thirdly, while we're encouraging and directing people towards where the nearest bin is, I think a lot of the emphasis should be on actually picking it up in the first instance, because having, you know, been a dog owner and, you know, picked up after my dog, I would have walked for a mile, you know, with the poo in my hand before coming to a bin, simply so it wasn't dumped. Whereas, you know, there's people who won't even walk, you know, the length of themselves, and they'll dump it on the nearest tree or the nearest, you know, while they may pick it up, they'll hang it somewhere or leave it picked up, which is actually even worse because then it doesn't degrade. So just those few questions, and thanks again for the presentation.
Okay, Councillor Cusack, thank you. Deirdre, back to yourself there.
Thank you for those questions. So I agree sometimes, depending on where your chosen site is, the councils will have to add more bins if there's very, very few bins to try and encourage it. We would kind of say a bin every 1 kilometre is really good. And sorry, could you just reiterate your first question again? Oh, sorry, actually it was about the monitoring, wasn't it? So yes, it is up to the local authorities themselves if they do want to monitor this, but I would assume that local authorities would want to monitor the effectiveness of it. And we do provide monitoring guidelines on how this can be done, and provide, you know, paperwork and spreadsheets and everything. Just a rough overview of it is that you would do your baseline monitoring of a site. So this is before any intervention has been put in place, any signs have been put up or anything. You'd go around and you'd count the amount of dog fouling that you see on the floor, whether that be bagged or unbagged, because as you say, some people bag it up and leave it there also as well. And then you would do your baseline monitoring a short while after that, your phase 1 monitoring, sorry. And ideally there should be a reduction at that stage, and then you do a phase 2 monitoring a little while later. Monitoring, ideally we've done it before, where a member of the council would go out and they'll count the dog fouling on like a Monday, Wednesday and Friday, and then do it the same days in phase 2 as well, and see the reduction there. But again, it's up to each council how they want to do it. That's just how we've put forward one way that they can do it.
Thank you, Deirdre and Lucy and the all the members for their questions and I suppose support and encouragement. It sounds to me like there's a lot of appetite across the committee to see if what way council and the Dogs Trust can work together, and hopefully we see that rolling out in the coming months, Deirdre. Look, as I say, we've no further indicated speakers, so just on behalf of the committee, thank both yourself and Lucy for coming today and for providing us with that information. It's greatly appreciated. We are now going to move on with our meeting. You're more than welcome to stay. I'm sure you've got more important things you want to do, but you're more than welcome to stay if you want. But thank you very much for your attendance here today, and to Lucy as well for joining online. Thank you.
Perfect. Thank you so much for having us.
And just before we move on, there was a question from Alderman Hussey in relation to how we dispose of it within the council messaging and around the putting it on the bins and stuff. So, Seamus, if you want to address that, please.
Thanks, Chair. And I suppose what we have been doing is purchasing dog fouling bags and providing them to dog walkers. So whenever the wardens are out carrying out patrols and they meet a member of the public who potentially doesn't have a bag, they're delivering those, and we're issuing them with the dog licenses as well. We're not required to do that, but it's just a step process to try and change behaviours. And an example of the bags that we provide is within the pack and the messaging within that. And I think there's a QR code to the council website which provides information for responsible dog ownerships. In relation to where the bags can be disposed, yes, they can be disposed in general waste bins, but it's probably good practice to use the designated dog fouling bins that are accessible throughout the council area, and we have increased the number of bins. We don't get many complaints about not enough bins. We've plotted those in a GIS map, which are available on the council website. If we do participate in this Walk This Way scheme, we will actually on the maps outline where the bins are. And the evidence to date suggests that the bins are used more frequently year on year based on the quantity of waste collected, which is a good sign. Thank you, Chair.
Through you, Chair. Thanks, Seamus, for that clarification. Much appreciated. Thank you.
Okay, Alderman Hussey, thank you. Councillor Cusack, are you looking to address something there through?
Yeah, thanks, Chair. I asked, basically, I know there was a similar project which was council led, and with the feet directing you towards foul bins within the Bay Road area. I was just wondering, while it sort of replicates what the Dogs Trust is doing with the Walk This Way, it was very similar, and I was just wondering how effective did they find that? Was it monitored? So that might give us an insight as to, if we go with the Walk This Way, project, what the likelihood of success is. And also just on the back of that, if I could be so cheeky, I know we always have a problem with dog fouling in residential areas, particularly in large parks, and we always have a problem with where they actually put the bins as well too. And sometimes it's been outrightly rejected, but it's something we need to consider more seriously, because I know residents in big parks and big developments are saying that they want these bins, and council sort of put up a bit of resistance. But I know that's because it's near people's homes, etc., etc. But whenever a good site's been located, sometimes even that can be resisted. And I appreciate all the problems that go along with it. But my initial question, and to stick to it, is just on the basis of that, project around the Bay Road with the feet and the Craigenburn Park as well too. How effective was that? If you have any information, that would be helpful.
Through you, Chair, simple answer is it's difficult to measure the effectiveness of providing those stencils on the footpaths. There is a cost associated with it as well. Very difficult to measure how successful they are. Probably the main point is that they're temporary and that they fade very quickly. And hopefully with this new initiative that there'll be permanent signage, which will help.
Okay, Seamus, thank you. Thank you, members. Moving on. Item number 6 is chairperson's business. I only have one item myself, but I have been contacted by 2 councillors on separate issues. My first is just very briefly to welcome to this committee Alderman Montgomery, who is replacing Alderman Darren Guy on the committee as notified at full council. Alderman Montgomery, you're very welcome, and I'm sure the committee look forward to working with you over the remainder of this term. The first councillor that have contacted me to raise an issue under chairperson's business was Councillor Hutton.
Thank you, Chair. I just wanted to raise, and it's not an issue, it's just something, it's 2 events that I attended last week, and I just wanted to raise them here at the Health and Communities Committee. One of them was the launch of the banner at the back of the dairy wall by Papyrus in relation to the Hope Line 24/7 number for young people who are having thoughts of suicide. The number can be accessed by the young person or by a significant other who has concerns about them and seek help and advice in relation to what to do next. There's a phone number, there's a text number, and there's also a direct email to a member of staff in Papyrus. I just think it's worth noting, and it's worth council noting, that maybe it's important for us to be promoting this number, as we are dealing with a lot of young people who are having suicidal ideations at the minute. They don't know, they don't necessarily feel that they will carry them out, but they just don't know how to talk about it or who to vent to, in order to realise that they can get help for them, and that sometimes these thoughts do creep into people's minds. And as long as we are able to talk about it and seek the expert advice, then it's okay. I just think that Papyrus are a UK-led organisation. Their presence in the city at the minute is magnificent. I'll be partaking in some free training that they're providing to community organisations tomorrow in relation to our role in helping people who are suicidal and are coming to us through referral pathways from statutory organisations in order for us to keep them well in their community. So I just think that Papyrus should be commended for the work that they are doing, and that the Hope Line number should be promoted through our council websites and communications and social media. So thank you for that. The second event that I attended, which I also wanted to commend, was an event run by the Family Voices Forum. And it was an event in relation to lived experience, and people got up on the stage and actually talked about losing a loved one to suicide. There was a lady who spoke about her son, your MLA Mark Durkin spoke about his sister, and Danny Quigley spoke about his father. It was run by Developing Healthy Cities. It was an absolutely magnificent event, and just to commend the organisers for arranging it and giving us so much useful information that we're used to reading in textbooks and policy and procedure, but actually hearing it from the horse's mouth and realising that there's more that we can actually do through learning through their lived experience was just second to none. So to commend the organisers, and also to commend those brave people who stood up and actually poured their heart out to the whole hall and the Guildhall. So I just didn't want to let it go unnoticed, because it had a big impact on me, and as long as I can keep spreading the word, it'll have impact on others. So thank you for letting me in.
Thank you, Councillor Hutton. In relation to the telephone number, I think it's a great idea. And I have seen it on the back of Free Dairy Wall, and thought it was a very forward step where we're actually, and you'll recall, Papyrus were actually gave a deputation to this committee only a few months ago, and it's actually having the guts to ask the question was the main theme of their presentation that day. And I think the more that we can promote their services, the better and the safer our young people across this district will be. So I fully agree with you. On the second issue, the event in the Guildhall, again, I fully agree with you, and I think it's important. And the unique thing about that event is that you're hearing, not only are you hearing it through people's lived experiences, you're hearing it from local people whose lived experiences, people who we know, who we knew long before these terrible, tragic events happened to them. And I think you're right, they're incredibly brave to stand up and share their story so that none of us, in the hope that none of us have to go through a similar experience to what they went through. And I agree with you, I think we should commend the organisers, and I think that this committee should request that the Mayor actually write out to the organisers and acknowledge the hard work that went on to doing that, and hopefully the progress that we'll see across this district because of it. I would definitely support that. I'm going to say Alderman there. Councillor Donnelly.
I've been called worse, Chair. So, no, look, I wasn't aware of them events, but it is a topic that's, you know, very raw and you know, somebody taking their own life, particularly a young person, anyone at all, but it seems to be more poignant when a young person does it. Is the devastation from that is it's incalculable in my opinion, and it has a rippling effect right throughout the family. So anything that you know, that can help prevent that, even if it helps one family, you know, if it saves one life, then you know it's vital for a particular family, you know. But I just like to thank Councillor Hutton for bringing that up, and I think that anybody in our sort of line of work, or people who are dealing with the public and community, I think it's becoming more prevalent. And what I've noticed is that there is more young people with issues, and you know, and they're trying to work it out in their own minds, and you know, and sometimes they don't even know that it's an underlying issue. It could be something from years ago, or a reoccurring trauma. So I think that we should do, and agree with yourself about the Mayor and that. So anything that we can do to help people who are in that position, that we have a responsibility to do it. And I also think, you know, if there is events coming up like that, if there's some way that council can let councillors know, then, you know, I think you'll find out that you know, in our line of sort of work, that there will be an increase at councillors attending, things like that. Thank you.
Thank you, right. Councillor Donnelly, thank you for that. Next indicated speaker, Councillor Jason Barr. You have two issues. I'm going to ask you to do the Murlock issue first, because I have another councillor who's contacted me on that. I'll bring him in and I'll come back to you for your second, if that's all right. Councillor Barr.
Perfect. Thank you very much, Chair, for allowing me on this issue, and it's something that officers are quite aware of now at this stage. The blue-green algae that has appeared in Murlock over recent weeks. Now, I know, thanks to Alderman Middleton yesterday for circling the email round that she received back from Council Dara of how they have basically are tackling the issue. So thanks to council officers firstly for taking the issue seriously, and also to Dara for carrying out the necessary checks. But obviously, if we have anything to learn from what's happened in Loughney, we need to make sure that this lake and loch is checked regularly, and to make sure it's kept at the top of the department's agenda. So can I request, Chair, that we write a letter to the Department of Dara and for their write a letter to the Department of Dara to thank them firstly for their investigations to date, but also to make sure that they keep this on the top of their agenda. Chair, thank you.
Thank you, Councillor Barr. Councillor Boggs.
Thank you, Chair, and thanks to Councillor Barr for raising the issue, which has now been going on since December. And first of all, I want to start off as well by thanking council officers, and particularly Seamus, for the work that him and his team have done, along with the media team, to get signs erected at Murlock. and that was done on some part in the reluctance of DAERA and the NIEA to act on the issue. So while I think it's an idea, yes, to write after the department to thank them for the action that they have taken in relation to monitoring so far, I think it's also important in that letter, if one is being sent, that we voice the frustration at somewhat of their reluctance to act on the issue in the first instance when it was first raised. And I know from conversations that I have had with others, they feel similar about that it wasn't taken as seriously as it should have been in the first instance. And if it had have been, then there mightn't have been so much rightly public hysteria around it, but that might have been able to be managed a bit more effectively at an earlier stage. So I would like that to be reflected in the letter as well, if Councillor Barr doesn't mind. And I know that this is something that we're going to have to work on, and I welcome others speaking up about it, because I think it's something that needs a team effort now from Council, from DAERA and from the Environment Agency. And I know that my own party colleague, Alicia McHugh, MLA, has a question to the Minister in relation to it. And I also know that our own party and the First Minister have made a commitment to water, improving water quality going forward in Loughnane and other places. And unfortunately, Murlough is one of those places now as well, that we are seeing it. But I think we need to come to some kind of quick resolution on it, particularly before March. I know there are sporting clubs and fisher men and women who use it from that spring period onwards, and they are seeking clarity around the situation. So I would urge people to continue to heed the advice from the Environment Agency and from Council. Again, welcoming officers' swift action in relation to getting signs up. We'll second the proposal from Councillor Barr in relation to the letter with the additional comments that I've made myself, and just urge Council officers to continue to engage with DAERA and the NIE in relation to it. Thanks, Chair.
Thank you, Councillor Boggs. Members, there's a proposal there that we write to DAERA with a number of comments from both Councillor Barr and Councillor Boggs. Is everybody happy that we do that? Yep. Okay. Thank you. That proposal's passed. Councillor Barr, your second issue there.
Thank you, Chair, again, for allowing me. And on this is just to raise awareness for Rare Disease Day 2024. So Rare Disease Day is a globally coordinated movement on rare diseases working towards equity and social opportunity, healthcare and access to diagnosis and therapies for people living with a rare disease. Since its creation in 2008, Rare Disease Day has played a critical part in building an international rare disease community that is multi-disease, global and diverse, but united in purpose. Rare Disease Day is observed every year on February 28th and then on February 29th on leap years, the rarest day of the year. Rare Disease Day was set up and is coordinated by Eurodis and 65 plus National Alliance patient organisation partners. Rare Disease Day provides an energy and focal point that enables rare diseases advocacy work to progress on the local, national and international levels. Can I request, Chair, that the Mayor light up the Council buildings in the colour of her choice from the logos, so that may be green, blue or pink, to mark this occasion and raising awareness and generating change for the estimated 300 million plus people worldwide living with a rare disease, their families and carers. Thank you.
Thank you, Councillor Barr. Members, there's a proposal on the floor. Happy to support, yep. Seconded by Councillor Duffy. Yeah. Okay, everybody happy to support that? That the Mayor light up the Guildhall on the 29th of February? Yep, okay, thank you. Right, moving on. Item number 7 is the matters arising from the open minutes of this committee on Thursday, the 18th of January, page 21 and 22. Proposer and seconder. I was the only person there. And I can't propose it and second it myself. Well, it's accurate enough anyway. I opened it, not much happened, and closed it again. Item number 8 is the matters arising from the open minutes of the Health and Communities Committee, Tuesday, the 23rd of January, pages 23 to 34. For accuracy. Opposed? Yep. Okay. And matters arising, sorry. Councillor Hutton, go ahead.
It's HC 12/24. Sandra had previously brought this up in relation to the Move More funding, because I wasn't present for the start of the last meeting. And it's just to see if there's any update, Barry, at this stage in relation to that funding. I do know that there was no prospect of it, but holding on to all hope that we can in relation to slippage monies or any spare cash that's running about, floating about. I just wanted to check and to see. We had a meeting, myself and Councillor Donnelly, on Tuesday at the Foyle Arena in relation to Pilot Row. And on the way out, we actually bumped into the facilitators of the programme. The hall was completely jam-packed. The smiles on people's faces. And I think at that stage, I just thought this would be such a pity if this was to leave this building, if the service wasn't to be afforded to those cancer survivors and indeed cancer thrivers. So just a wee update on that. And it's just to reiterate sort of the passion for everyone in this chamber to see this service afforded to cancer patients and their families. Any update, Barry, or is there any talk of, I know there was talk of council maybe subsidising it a wee bit, and then there was a fear of diluting the services and maybe people not getting what they had got before. So I would appreciate just a wee update if there is any.
For yourself, Chair, there is a bit of an update. No, there's no new money in terms of Macmillan. They have said there'll be £5,000 over a couple of years for training up facilitators. We have looked internally and with a meeting with PHA this week. And again, there's no new money, but they are content from one of their programmes to reallocate monies through Healthy Towns for this. But look, the reality of it is we won't have 100% funding to continue on this basis. So the service will continue in some shape or fashion, but it won't be 100% all cancer rehab. You know, I can't give a percentage until PHA agree to all this, but they've said we can use some of the Healthy Towns money to keep the coordinator and that in place and run, but it won't just be cancer rehab, but that'll be a very large element of it. But you know, it won't continue in the same guise unless there's new money comes in. But we do plan to keep the service and all of the main facets that worked well, but it just mightn't be that there's 12 people who had a cancer diagnosis or overcome cancer. It could be 12 of them people with other conditions, and the PHA will indicate that. So that's the latest update. We will bring a further report in when we have further information on it.
Thanks a million, Barry. Thank you.
Thank you, Councillor Hutton. Thank you, Barry. No further items under matters arising? No? Okay. Item number 9 is the update on dog control activities during the current financial year, and that's Seamus, please.
Thanks, Chair. Members, the report outlines the various pieces of legislation relating to the control of dogs in this council area. It also outlines the education enforcement activities that the dog control team carry out to help improve responsible dog ownership, which includes the issue of dog licenses, the collection and rehoming of stray dogs, investigating attacks on people, other dogs and livestock. The dog wardens carry out regular patrols to help determine compliance, and where breaches of dog control legislation arise, action is taken in accordance with the Council's enforcement policy. The report also outlines the information councils provide to DAERA on a quarterly basis, which includes the number of licenses issued, service requests received, investigations undertaken and action taken. DAERA is also currently considering the way forward to deal with dangerous dog breeds such as the American XL Bullies, following a recent ban from owning this breed of dog in England and Wales. The work plan for 24-25 includes those statutory activities mentioned earlier and the various other initiatives and activities that will be carried out with the help of other council departments, agencies and groups. This includes working with the Dogs Trust, as we've discussed earlier, to create additional walk this way routes and build on success of previous trials. The members, the recommendation is that the committee approve or note the update and approve the dog control work plan. Thank you, Chair.
Thank you, Seamus. Members, there's a recommendation there. Councillor Hutton.
No, just to say that we welcome it. I suppose there has been a big investment in this over the last few meetings, and that's really good to see. And it's really reassuring for residents and members of the public to see that we're discussing this at length and that ideas are coming forward from elected representatives. So continuing to do what we're doing, I think we will be able to provide some sort of reassurance to people. But Seamus, just to thank you and the team. I know I've been on these quite a bit this past couple of months, but your work has been tremendous. It has put people at ease, and it has actually supported people and educated some residents in relation to really that nothing goes unnoticed, and reassuring other residents that we are listening to them as well. So no, happy to propose that this is fine.
Okay, thank you, Councillor Hutton. Councillor McDade.
Thanks, Chair. Just I'll second that if we need seconded. I mean, thanks very much for the report. I feel like this committee talks about dogs a lot. But it's important, obviously, and it's good to see the plan there. I'm just reading through it in more detail. I think we need to be doing everything we can to make sure the public feels safe, not just non-dog owners, dog owners as well. So no, thanks very much for the report, and I'm happy enough to second it. Thanks.
Thank you, Councillor McDade. Councillor Donnelly.
Chair, look, can I give it a guarded welcome? And that's simply because I've had IT problems and haven't been, and it's an extensive report. So from this item on, I haven't really been able to analyze them all, but it is an important issue. So I just want to put on record, yes, I'm supporting it, but it's a guarded one because of the lack of opportunity to, you know, really dig down on it or read it properly. Thank you.
Thank you, Councillor Donnelly. I can confirm that a number of our group have also had IT problems. So just to confirm that Councillor Donnelly is not coming to this meeting unprepared. It's at least this month he's got an excuse for not reading the papers. No, okay, so that's been Councillor Cusack and then Alderman McMorris.
Thank you, Chair, and I just wanted to take this opportunity to thank Seamus and the team for all the work that they've done with regards to the dog pound. As you know, I was there with these before Christmas and saw the interim works, and hopefully the things that we discussed are being progressed. I was delighted to see how council acted really, really quickly with regards to being able to advertise online on the council's website, Facebook, etc. You know, dogs that had, you know, unfortunately come under the care of the pound. Just a quick question for Seamus: how are things since? How are you coping, and what is the amount of dogs that are coming under the council's care, and how quickly are we being able to either rehome them or reunite them, or, you know, pass them on to one of the charitable organisations? Thank you.
Through your chair, Councillor Cusack, I had been at the kennels on Tuesday, and there was 5 dogs currently impounded, and we hope to have all the dogs rehomed within 5 working days, as the legislation requires. In terms of service delivery, it's continuing as normal and no difficulties. We still have to carry out some repairs to the kennels, and we hope to have everything complete by the end of this financial year.
Thank you, Seamus. Alderman McMorris.
Thank you, Chair, for letting me in again. Seamus, thank you for the work that you've done in this report. And can I also just put it on record that I thank you and the team for all that you've done. I know I was one of the ones that was vocal about the issues in and around the dog kennel, and unfortunately I didn't get down to the dog kennel when I was first invited, but I got down on Tuesday, and I was really, really impressed by, you know, what the work you were doing, and you know, you answered every question that I had. I seen the kennels working really, really well. Looks really, really well. All the dogs seemed happy. So this is really a welcomed addition, this dog plan. And I just hope the good work continues. And yeah, well done. Thank you.
Thank you, Alderman McMorris. Councillor McDade.
Thank you, Chair. I just wanted to ask, if the dog isn't ready in 5 days, what happens? And don't tell me if it's bad news, but like, how long do they last? Can you keep them? Can you extend them 5 days? Thank you.
Through you, Chair, we aim to have the dogs rehomed within 5 days. If that doesn't occur, we would liaise with the animal charities, and Dogs Trust being one of them. And to date, we've been successful in having, there are occasions where some dogs just cannot be rehomed, whether they've been involved in an attack or whether it's ill health or whether they're dangerous to rehome. But that's very seldom. Thank you, Chair.
Okay, the recommendation for that report has been proposed by Councillor Hutton and seconded by Councillor McDade. Everybody happy enough? Yep. Okay. Item number 10 is the Community Centre Venue Fund for 24-25. Barry?
Thank you, Chair. Members, the purpose is to update you in the venue fund for 24-25 and to seek your approval to make a minor revision to the application form. Members, you'll be aware that this venue fund first opened around 2017 and 18, and its primary purpose is to provide financial support to non-council owned community centres within the council area. There's two tiers, one of 120,000, mainly for the rural groups. You can get up to 12,000 per venue and 75,000 budget for the urban groups. So members, having reviewed the impact of, and we've discussed this at a grant aid working group, the changes agreed for the 23-24 allocation, officers have identified the proximity to services question is not really required, and it has an unfair impact on rural applications, particularly those rural groups that are closer to the city. This has been debated quite a bit and been the basis of a lot of discussion around community consultation on this and other grant aid programmes. So the inclusion of the proximity to council-owned community managed venues was included for 23-24. It ensures council are addressing gaps in both urban and rural areas, and the unified the application questions for both urban and rural areas. The criteria applying for the CCVF remains the same as the previous year, apart from this one particular issue. Members, you'll also be aware that this programme was initially designed to cover a 3-year period to give sustainability to groups and to continue their provision and delivery of community services. It's been allocated since COVID on a yearly basis, and we've been getting quite a bit of feedback as well from groups that isn't really a sustainable model going forward. Officers also and members will be aware that the 12,000 doesn't cover anywhere near all the costs around the community centre. However, it does provide some security and sustainability of those centres that are successful and allows groups to leverage in additional funds. And again, members will be very aware of this one. Because of the limited budget of 195,000, this programme is always oversubscribed, and we won't be able to fund everyone that applies, and there are lots of good applications that unfortunately won't be funded based on the budget. So members, just from a quality point of view, in this slight change, the quality screening was carried out, and you'll see it in your Appendix 1. And whilst there might be minor impacts for some of the Section 75 groups, they're all positive. Members, again, you'll see in Section 4 we're talking about, we think it's imperative to have an open call that looks at 3 years and we can review on an annual basis. So the recommendation is you approve the removal of the proximity to services question for the venue fund for 24-25 and including approval of an open call process for a 3-year period subject to funding in place for each year of the programme. Thank you, Chair.
Thank you, Barry. Barry, this might sound like a silly question, but I'm going to ask it anyway. Would you mind, in terms of this fund, defining what is required as a community centre? The reason that I ask is because just before coming to this meeting, I left what I would describe as a community building that run lots of services within it for a particular community, but may not be traditionally described as a community centre as such. But there's a lot of activity from what I could see going on within that building, and I would be interested to see if an organisation such as that would be entitled to it, or is there a specific definition of a community centre that requires you to meet before you can apply for this fund?
Through yourself, Chair, without going into the detail and having all of the detail criteria in front of me, it's more around the activities and how the group is constituted. So in the past, over previous runs of this particular fund, and I think the last fund, there are a couple of sports clubs that have actually secured this funding because they run community activities and they're constituted in a certain way. So it's more about the activities that are delivered rather than someone called a community group. I hope that answers your question.
No, it does, but it does, and I'll come back to you on it. later on. Councillor Devine.
Thanks, Chair, for letting me come in. Barry, thanks for the report. As you've outlined, this funding is really valuable funding for community centres outside of the council-owned ones. It's providing, those centres are providing really valuable services, particularly, I'm speaking as a rural councillor, particularly in rural areas. And it's very welcome that that funding would now be delivered in a three-year basis, because I mean, constantly you hear about insecurity and being able to plan ahead. I suppose we're all aware that costs have gone up, and I'm sure you know you're well aware of that from the council-owned community centres. And the same applies for those groups. And I know you're saying that funding is limited, but I would propose that maybe we could write to the department and ask them, is there any additional funding? Because those services have been getting that same amount of money, or that same amount of money has been made available for a long number of years now, and there's been no increase in terms of costs associated with that. Look, happy to propose that we make those amendments as well. I'm happy to propose that, but if we could maybe see about getting some additional funding to cover additional costs.
Thank you, Councillor Devine. Members, Councillor Donnelly, go ahead.
Chair, look, I'm going to abstain this. As I said, I only got into these notes about 20 minutes before I set off from here. But it's just I've got as far as 2.3, and it says fund is allocated over 2 tiers to a maximum of 120 per venue. Tier 1 of the community centre venue fund targets community centres based in one of the 3 rural DEAs, and then it names them. What does that actually mean? Is that only one of them 3 areas that money's going into, or?
Well, through yourself, Chair, that 120,000, Gary, is allocated to the rural areas, and they apply for that 120,000. They can all get a maximum of 12,000. The urban one, there's 75,000 allocated to that, and you can get up to 7,500. So all groups can apply for that.
And it's just the wording where it says it targets community centres based in one of the 3 rural DEAs only.
Yeah, I think that's a typo. So it's
right. Doesn't say it.
Have enough, Councillor Donnelly? Yep. Okay. Councillor Barr.
Chair, thanks very much again for allowing me, and just to echo what Councillor Devine has said and agree everything Councillor Devine and her remarks that that funding definitely does need increased, especially within the rural DEAs, because as you know, the rural DEAs are segregated from the city and the towns, and they rely on their community centres as their focal point within their community. So definitely the funding definitely needs increased to continue and to progress more within those communities. So I'm happy to second that proposal. The letter goes to that specific minister. Chair, thank you.
Thank you, Councillor Barr. Members, it's been proposed by Councillor Devine, seconded by Councillor Barr. Everybody happy enough? And Councillor Donnelly is abstaining. If we could just record that, please. Okay, member. Yeah.
Chair, I'd indicated to come in.
Sorry, I beg your pardon. Alderman McMorris, go ahead.
No, you're right. It was just to basically make a couple of comments on it. Whilst I'm from the urban, do you know what I mean? It's really, really welcoming to see the emphasis put on the rural, because I know how much they struggle. But in regards to rural, we have a community centre within our own Waterside DEA, and I know from speaking to them on a regular basis that they really do struggle with overheads and whatever. And you know, this is really, really welcomed, and it's good to see that they're like doing this here on a 3-year strategy, although it's subject to funding, but it gives them a wee bit of reassurance that if the funding's there, that you know that they can roll that out raving quick. But just want to welcome it, and thank you for letting me in.
No worries, Alderman McMorris, thank you. Members, moving on, item number 11 is the Good Relations Bid to the Executive Office 24-25, and Barry's going to take us through that report.
Thank you, Chair. Members, the purpose of this is to update you on the funding bid that has went to TAO for a Good Relations programme. and to seek your approval, the funding bit attached in your appendices. Members, I'm not going to go into the detail, but you'll be aware from last month's committee that we have been told to expect again a 47% cut. We don't know, is that going to change now that the executive's back up and running, but we will bring a more detailed report back. We've submitted, if we were to get 100% of what we got 2 years ago, adding the 47%. So we'll bring a further detailed report back to members, but there's no point in speculating around this. But if members, you'll see from last year, 47% cut means much less programmes run. So we'll bring a further report back once we have clarity from TAO after this process. Thank you.
Okay, Barry, thanks for that. Members happy? Councillor Boggs.
Thank you very much, Chair, and thanks, Barry. And I won't reiterate everything that was said in the working group, but just I suppose just at committee, just to thank the good relations officers who have put so much work into this. We now have what we would like to see as a fully funded good relations programme, but I think the approach that officers have taken in relation to the traffic light system of, if we get the full funding, then we go with green, and if we get some funding, then amber, and then obviously we don't want to have to look at the red approach. But it's a pragmatic approach, and I welcome it. It shows that we're at least planning ahead for what might come. And I just want to commend officers as well on the focus on young people. And I made the point in the working group, the focus on young people is important to achieve the funding, but I think it's also very important for the community impact that it will have in relation to the issues raised within the funding. But so just to commend officers on the funding but so far, Chair, and look forward to seeing the response that come back from TAO, and happy to propose if we need to on that item. Thank you.
Yep, thank you, Councillor Boggs. That's a proposal. Councillor McDade.
Yep, thanks, Chair, and thanks, Barry, for the report. I had to send my apologies for the last good relations working group, but I suppose just as Councillor Boggs has said, we've already expressed our disappointment that this is possibly going to be cut, but just to express it again, by cutting it by 47%, shocking. But I think the system that has been devised works well, and it's clear for us to see then what's definitely, what's maybe, and what's hopefully not going to be cut, but what is likely if things don't change. But no, thanks. I'm happy to second the report as well. Thank you.
Thank you, members. Okay, no further indicated speakers. Proposal seconded. And as Barry has outlined, officers will bring back a further report in due course. Happy to move on? Yep. Okay, item number 12 is council-owned community managed centres programme. Barry?
Thank you, Chair. This relates now this time, members, to our own centres, and you'll see the purpose of the report is to request a budget allocation be identified to undertake a rolling programme of upkeep works to our own community centres. Members, you'll be aware that in recent years we've had a tight budget constraints this past number of years, and it's mainly essential maintenance relation to health and safety carried out at our community centres. So what we're asking your approval for today is their centres need things like painting and upkeep works, that we look and identify a rolling programme of works and identify a budget of somewhere in the region of £100,000 through any underspends, and we're seeking your approval for this rolling programme of works within this financial year so that we can do work as and when is required at our 19 council-owned community managed centres. Thank you.
Thank you, Barry. Alderman McMorris on this issue, in this paper, sorry.
Just a quick comment on it, just a declaration of interest as chair of Irish Street Community Centre. But I'd just like to welcome us, Barry, and just want to put on record too, me thanks to Paul, who takes care of the centres. He does a sterling job, and he keeps maintenance and everything really up to date. And I just wanted to put that record, but this is really welcomed money for all of the centres. Thank you.
Thank you, Alderman McMorris. Councillor Devine.
Thank you, Chair. I appreciate that there's budget constraints, and you've highlighted there about the importance of maintaining and complying with health and safety standards. One of the, I'm sure you're aware, Barry, one of the council-owned centres in Victoria Bridge has been closed because of health and safety. And unfortunately, those issues were highlighted for quite a while, and they weren't addressed. Now, I know it's an older building, it's kind of a porta cabin, but the downside of that is now we have a community group who has received funding through the National Lottery to develop programs, and they don't have a community centre now to deliver those programs. That funding is time limited. And that's very disappointing. And I know there's some work going on at the minute in terms of trying to get them access to another venue. I suppose I'm looking for a bit of an update on that and where we're at with that. Again, happy to approve that we go ahead with the funding, but how does that work? How would those works be prioritised? Is there some kind of a plan around prioritisation criteria around how that work takes place with that budget? And is there, can you come back with some information or paper around that?
Thank you, Chair. It's through yourself, Chair. Yeah. In the last number of years, really, since COVID or even pre-COVID, because our maintenance budgets, it's costing more to actually run the centres, from in terms of heating, fuel, lighting, that sort of stuff. So we have a budget allocated each of them, and we've only been doing the essential health and safety if it's around Legionella for any of a certification and stuff. So it's as basic as giving those buildings like a paint every 3 years, doing general upkeep works if there's bits and pieces of the kitchen needs repaired and things like that. Yeah. So what we do plan to do is keep itemize all of the things that we're doing at all of the centres. There are some that are more pressing than others, and we'll bring further update reports back into committee around that. With regards to Victoria Bridge, yeah, I'm aware of the issue. The discussions haven't really went anywhere in terms of the access to another venue. We've actually meeting with a group organised next Monday to outline the next steps and outline what council's position is, that we feel the next step should be going through and putting the replacement building in place and doing the works that need to be done at the existing site. And I know that that'll take a bit of time, but obviously the cabin will need lifted up off the ground and needs to be proper damp proofing and all of that in place. The reason was it was just set there in the first instance and the floor rotted. So that will be the officer's recommendation to the group, that we proceed and go through the capital process to get this replaced as quickly as possible. Thank you, Chair.
Please, so there isn't really a short-term option at the minute?
Officers have had discussions with the group that the Victoria Bridge group themselves had asked us to see could they get access to it, and it hasn't been met favourably.
Okay, Barry, thank you. Thank you, Councillor Devine. Councillor Barr, Jason Barr.
Just to come in, again on the back of what Councillor Devine says, some of the DA that I represent falls on behalf of Victoria Bridge also. So hopefully, maybe a meeting, a cross-party meeting, can be set up, Barry. Hopefully that we can come to some sort of resolution for that community centre. Other options, maybe the government, I don't know, something that can come to a good resolution for the residents of Victoria Bridge, especially because funding sitting there that needs to be used. It's very important that it does be used. But just look, thanks for the report on that, and I'm happy just to second it on that basis. Thank you.
Oh, okay.
Through yourself, Chair, we're meeting the group on Monday and we're making a recommendation around the replacement stroke refurb of their existing facility, and then we'll go away with our capital team to put that in motion.
Okay, thank you. Members, the report has been proposed and seconded. I'm happy to proceed. Councillor Devine, yeah?
Apologies. So can I just clarify that in terms of that funding, you're going to come back with a report on how that's going to be prioritised across the different centres, Barry?
I'm not sure of the question.
So the funding, we're proposing 100,000 for renovations within the centres. How is that going to be prioritised, or how is that going to be assessed?
Through yourself, Chair. So we have 19 council-owned community managed centres, so we'll be looking at all of them, what works need to be done, and we'll itemise all of that and put it in the report and come back. It'll not, the 100,000 won't cover anywhere near what needs to be done and what hasn't been done in the last number of years, so we'll be just itemising on the list what's required.
I know one community centre manager that Councillor Duffy and I had been working with. Actually, could probably spend that 100,000 themselves. Plus is right. But we'll move on. Item number 13. is the UNICEF Child Friendly Cities Programme Review.
Thanks, Chair. Members, the purpose is to update you on the second 6-month progress review that was held this month as part of the UNICEF Child Friendly Cities and Communities Programme, and to agree child rights as a standing agenda on the Health and Community Committee, as recommended by politicians and lead organisations at your say child rights event. Members, you'll see there that the 6-month progress review took place in July 23, and the green rag rating was allocated from UNICEF with key areas identified for development. The second 6-month review took place on the 1st and 2nd of February in the form of a 2-day visit from UNICEF, and that included face-to-face meetings, conversations with coordinators, politicians, senior leaders and professionals working to deliver the action plan across the district. Children and young people's voices were also included in the form of site visits to 2 locations in the district where child rights are being embedded directly into services. And key progress since the last progress review for reporting to UNICEF UK is outlined in the report. So members, in terms of the recommendation, that you note the contents of the report and you agree child rights as a standing agenda item on the Health and Community Committee. And members look happy to answer or come back to any members of any questions of any of the main bodies. It's a very, very detailed report, so we can come back with any further queries that members may have. Thank you.
Councillor McDade and then Councillor Hutton.
Thanks, Chair. And thanks for the report, Barry. I'm happy to propose that we accept the recommendations. Just on the Child's Right event that was held, it was absolutely fantastic, and it's worth everyone kind of looking at that in detail. Gary, you got to be looking at it tonight, because the feedback actually provided by the young people there was unbelievable. And there's a bit there, the child rights statements, and that was young people stood up and read out a right and what it meant to them, and it was really, really powerful. Like, I have to say, it was a brilliant event that I attended and I had the option to speak at, and I really was really impressed. I know that Councillor Hutton and I are both part of the UNICEF Child Right champions, and it's just something that's really important. I think that we should be discussing it every month, because we are on track for our district to become a child's right friendly city, and the children and the young people in this city and district know more than a lot of the adults, and we should be listening to them and we should be giving them every right to speak. Thank you.
Thank you, Councillor McDade. Councillor Hutton.
Just a second, everything that Catherine says, and it is important that we are raising this issue every month because it's changing that much. There's that many recommendations coming through when we're sitting on the panels. And as Catherine rightly said, child rights is a massive, important piece of work that we're not only doing here in council, schools are doing it, we're doing it in community organisations, and children are learning more and more about their rights, which is developing their brains. They understand exactly what they should expect from communities and families and healthcare systems and all of that. So happy to second with the proposal. And just to come in, Claire Lynch, I have to say, she is running a tight ship. That girl has everything down to a T. She's got us all lined up when we need to be lined up. She's got every single training session sorted out. So big shout out to Claire because she's coordinating this within an inch of her life. So just wanted to mention that.
Thank you, Councillor Hutton. Members, again, proposed and seconded that the child rights becomes a standing order on the Health and Communities Committee, which I think will make this committee that little bit more interesting. We're being honest about it. Yes. What am I looking at? Oh, Alderman McMorris, go ahead.
Sorry, Chair. Thanks for letting me in. I also am a UNICEF champion, and I was also at the Child's Rights event, and I also done the training. And I have to say, you know, I think it's really important that you know, all of the councillors avail of the training. It was said loud and clear from the young ones that they felt it was important for their voices to be heard. And I really do think that, you know, we have to keep that on the agenda so that we can hear the voices of these young adults. Another thing too that was just really struck me was about, you know, how they knew and were, you know, aware of what the rights was. But there's a whole lot of issues, and you know, that they need to be bringing forward. And when we were doing the training, one of the things, it really challenged us to think about how we view child rights, and do we really understand what the needs and wants of these young adults are. You know, that was one of the things that I learned, and just encourage everybody to do the training, and yeah, and keep supporting this strategy. And again, as Councillor McDade said, Claire Lynch has been amazing through this here, and a big shout out to her as well. Thank you.
Thank you, Alderman McMorris. Okay, members, moving on. Item number 14 is HIV Fast Track Cities Initiative, and that is Barry.
Thank you, Chair. Members, the purpose of this report is to advise you on the HIV Track Cities Initiative. It's an international initiative with a goal of ending the HIV epidemic by 2030. The campaign by Positive Life is to make Northern Ireland the HIV Fast Track region to eliminate 0 new HIV diagnoses by 2030. Second purpose is to seek your approval to sign up to this initiative. Members, you'll see in the key issues that Positive Life have asked Council to sign up to this in advance of Sexual Health Week, which commenced on the 12th of February. It's largely a symbolic exercise, which will involve some publicity. Positive Life will provide free HIV awareness training to all council staff, elected reps, and across the local community. So in terms of the recommendation, members, that you note the content of the report, and we sign up to the HIV Fast Track Cities Initiative and work with Positive Life. Thank you.
Thank you, Barry. Councillor Sandra Duffy.
Thank you, Chair, and thank you, Barry. And I am more than happy to propose and support this initiative. It may be symbolic, but it is mainly about awareness raising and education around these issues. Unfortunately, HIV, there is still a lot of stigma and a lot of myths around it that need to be addressed. And I think that there has been so much progress and so many breakthroughs in recent years with PEP for post-exposure and PrEP for pre-exposure for people who are in high-risk categories that actually prevent HIV from taking hold or developing, and then the medication that people can actually take so that HIV is completely undetectable in your blood. I think that all that is really important, that we educate people around getting tested, around safety of themselves and how they go about that, but even just in terms of the breakthroughs, because I think that I watched Tommy Tiernan last week. I'm going to go off on a tangent, and he had a lady on who had been exposed, who had got PEP, but it didn't work, but is now on medication, and the HIV in her blood is completely undetectable. She lives a completely normal, healthy life, no different from anybody else, and cannot pass HIV on because of the medication that she's on. And I think those are the messages that we need to be getting out to people, that over years we heard about HIV being a death sentence, we heard it being confused with AIDS. We have moved on from there, and people need to be aware of that. So more than happy to support the proposal.
Thank you, Councillor Duffy. So that's proposed by Councillor Duffy. Councillor Boggs online.
Thank you, Chair, and Sandra has covered the issue very, very well. So just happy to second the proposal and to endorse everything that Councillor Duffy has already said.
Thank you, Councillor Boggs. Members, that is proposed and seconded. No further indicated speakers. Oh, sorry, Councillor Donnelly, go ahead.
No, Chair, just look, they agree with what Sandra has said there. You know, I had been speaking to somebody not too long ago who has HIV, and he was telling me that it's down if he takes 1 tablet a day and that he can lead a normal life. And I think that if we look back with that terrible stigma where people died alone, and you know, it was horrible times, and there is still, as Councillor Duffy pointed out, there is some stigma that still exists. And there is issues that there's misinformation being deliberately peddled by people with agendas too. So I think that anything that can debunk behavior, I think it you know, it's a welcome development, and just to wholeheartedly support this recommendation. I was able to read it there, so stick my neck out. Thanks, Chair.
Thank you. Okay, that's proposed and seconded, and Alderman McMorris is a happy to support online. So happy to move on. Yep. Okay. Item number 15 is the response to the Department for Communities consultation on voluntary and community sector infrastructure support. All right.
Thank you, Chair. Members, the purpose of this report is to advise you in a consultation response submitted in relation to the DFC consultation on the infrastructure support. For further update, we previously presented. DFC has put forward draft proposal to support a thriving voluntary community sector through a commitment to continued government investment in sector infrastructure and improving the way that government works with and for the sector. Proposals are geared towards the achievement of a clear ambition for what joined up government support can help achieve in the sector, underpinned by shared values and practices, which aim to support the relationship between government and the sector. I know some elected reps were at the event in held Motherside Shared Village, and we give our, as an officer team and elected reps, our views towards this. And I know we're in a climate of reduced budgets, and Councillor Devine has mentioned about asking them for additional money around the venue fund. So we will continue to lobby DFC around this to get more money in through our VCU grant, so and various other infrastructure support programs. So we continue to be on the case around that, member. So in terms of recommendation, that the content of the report endorsing the draft consultation response submitted to DFC. Thank you.
Thank you, Barry. Councillor Hutton.
Thank you, Barry, for that report. I was at that event, as you said, and I was also at the one in the morning, which was most community organisations in the area had attended as well. And I think it was there were two very progressive meetings. Number one, it was nearly like a test and learn sort of situation where they were explaining that government departments are going to be committing to be working together. They try and make their own budgets last longer by collaborating together. For instance, if there was a programme going on the school through Department of Education and it was on and around health, those two departments should be working together so that they're not spending as much money on one initiative and the community. So we really, really welcome that, and I think they took a lot of learning from the community organisations on how we work collaboratively and work smartly so that we're not all going for the one pot of money for the same programme. In relation to the one in the afternoon as well, it highlighted really well how the community sector do struggle to retain staff due to the funds not being long enough, or the longevity of the funds and the consistency of the funds. So I think there has been people harping on about this, particularly Deirdre Harkey, in relation to having support within the community sector so that we can retain staff and give programme provision for longer than what we do. And the fact that all of this has been highlighted, the fact that we're all around the table, and the fact that it's being discussed is very, very promising. And I hope to see more test and learn situations like this. The community sector is a very, very valuable sector. And some of the work that they do is actually saving government departments money. So that all needs to be taken into consideration. I love collaborative working, and I love the fact that government departments are now going to work collaboratively so that the community sector and local councils can benefit as well. So just to mention that.
Thank you, Councillor Hutton. I'm sure your party colleague Deirdre Hargey will be delighted to hear that you said she's been harping on about it. Particularly Deirdre Hargey.
Very slang.
Okay, so that's proposed by Councillor Hutton. I need a seconder. Yep, Alderman McMorris, go ahead.
Yeah, thanks, Chair, for letting me in, and I'm happy to second that proposal. Just a couple of points. I was at the presentation at DFC and whatever done. And it was just a couple of points under point 8 about the joint forum. I just wanted to mention, it was brought up by numerous people, but that it was vital that membership of the joint forum is reviewed to ensure membership from right across Northern Ireland, as membership at the moment is very Belfast based. And also just a note on point 12 under leadership and advocacy, the consensus was that more needed to be done to attract young people into the community sector, especially within the PUL community. Mentoring support should be offered and increased access to qualifications. Currently, the community development and the community youth work degree is only being offered in Belfast, and it has been in the past delivered in McGee. So that's also another point that I wanted to highlight. And under point 18, under core capacity, it's vital that capacity building is supported at a local level. Currently, most of the capacity building is being offered by NICFA and Belfast-based. NICFA charge for many of the services which smaller groups can't afford. So I just wanted to make them kind of points to yourselves. Thanks, Chair.
Thank you, Alderman McMorris. Councillor McDade.
Thank you, and thanks very much for the report, Barry. I suppose just we support it wholeheartedly as well. So just to put that on record, but just whenever I was listening to Councillor Hutton speaking there about the importance of the community groups and the community sector and the community and voluntary sector, as someone who works in the statutory sector and the trust, I can wholeheartedly say the difference that makes from the statutory perspective is unbelievable. And I've been working closely with the Right Time, Right Place through the Bogside and Brandywell Health Forum, and the difference that makes for people who then don't have to go through statutory services when they're coming out of hospital is unbelievable. So it's going to save money in the long run. So I'm glad to hear, Barry, that you're going to continue to lobby for more money, because I think every penny will help here, and it doesn't matter how little or how big. We need as much as we can get. So thank you.
Thank you, Councillor McDade. Members, that has been proposed and seconded, and everybody's made their point, so happy enough to support. Yep. Okay. Items number 16 to 21 are open for information, which I don't intend to go over unless anybody has a specific paper that they wish to address. Items 16 and 17 from Councillor Deeney. I'm going to try and do this in order. So, Councillor Deeney, item 16, first of all, please.
Yeah, it's just to thank the officers for the report. I would like to commend them on the great work. There was great attendance at the events from the report, which is brilliant. It's something I'm really passionate about, and I would love to see the recording on the council website just being promoted as much as possible, because I think it's brilliant what they've done.
Thank you, Councillor Deeney. Item number 17. Now you want to go ahead, Brad?
Yep. So thanks again for bringing the report forward. I don't know how many times I've said this in the chamber, but we know it's a massive problem. And to see 24% of year 12s VIPing is shocking. Last time we spoke about the VIPing, I asked if council officers could tie in with a representative from Belfast City Council, and I was just wondering if we were able to get an update or we were able to make any contact. I know from some of the groups that they do really great work in Belfast City Council. They were able to test underage sales and deal with multiple complaints regarding vapes on a weekly basis with 2 tobacco inspection officers. And could I also ask, does retailers in our council have to register? Because in 3.7 of the report it says they don't. And do we inspect, and how often? Is it only when we get a complaint, or just what way does it go that way, you know? Thank you.
Thank you, Councillor Deeney. Seamus?
Thanks, Chair. In relation to the first question, we are liaising with Belfast City Council, and I understand there's a meeting next week. I'll bring a report back on that. We'll also include in the report some of the work that's been carried out in terms of test purchasing, which has taken place recently, and just to confirm that retailers currently don't need to register. Thanks, Chair.
Thank you, Seamus. Happy enough, Councillor Deeney?
Yeah, that's great. Thank you for that update, Seamus. Just to ask, Seamus, do they have to register anywhere? Or they're sort of saying that they don't, but I've heard that in Belfast they do have to register. Is that not true? And just throw it out.
I'm not aware of them having to register. I know in relation to tobacco products, yes, but in terms of the vaping, my understanding is no. And I think that's one of the gaps that's been highlighted in this report. But I can confirm potentially next month, yeah.
Thank you, Seamus. Councillor Donnelly on this paper?
Yeah, Chair.
Yeah, go ahead.
Look, again, I was only able to see this item, but there is a a rising alarm regarding the number of young people who are vaping, and there's no doubt about that. But there's also been a number of reports recently of young people having taken ill by vaping and whatever substance that has been in that. I'm not sure, haven't read the report, but is that being dealt with within this report, or is there figures, or have you even heard as council, is that information coming to council of young people who have collapsed by vaping, not your conventional that you would buy in a shop, but substances within vapes? Has that been brought to attention, or?
Currently don't have any data on that, Councillor Donnelly, but I suppose those reports will go through the statutory health partners, and we can follow up with those and determine if there is any figures available.
Yeah, I think it's important because, you know, you will read reports in social media and that, and you know, and social media can be inaccurate or can be sensationalized. But I think it's important that you know, there is information on that type of activity that, you know, that we that we know as elected reps, and not only us, but parents and guardians and teachers, and that, you know, that there is a trend. I don't want to be alarmist here, it's not what I'm doing, but there has been a number of reports on social media, and I think that, you know, I think if we can get an accurate picture on that type of whether it's happening or it's not. Thank you.
On this, yep. Thank you, Councillor Donnelly. Councillor Hutton on the same paper.
Thank you for letting me in, Chair. Just what Gary's saying, there was a few incidences in our communities over the past couple of weeks, which were very, very scary, not only for us as community workers, but the families that were involved. These rechargeable vapes that the young people are using are not putting nicotine into them. It's substances such as spice, which young people are taking a really bad reaction to. I'm a member of a task and finish group throughout the north that's dealing with behaviours in young people and vaping. What's making them vape? Is it peer pressure? Where are they getting the money to vape? There's a whole array of investigations that we're looking into. But just to highlight what you were saying, Gary, that those concerns are there with parents, teachers, young people. And we're developing a landing page on the PHA website that's going to be a support document for teachers, parents, grandparents, young people that are considering vaping. There's also going to be resources produced. We worked with the Scottish health community, the Scottish Community of Health as well, and what they were doing, and designed our material and around their stuff as well. So it's really important messaging, and it's going to tackle that sort of element of why young people vape. It's not going to inform people of the health implications of vaping because we don't have the evidence or the research yet. That is being developed. They have to wait a certain amount of years from the e-cigarettes come out before they can start testing for the health implications for vaping. But it is really important that we're educating and supporting parents. There's a lot of parents coming to organisations like ours that deal with no smoking services, but that's tobacco. And we're trying to advise them as best we can. But this task and finish, we are meeting every 2 weeks. We're working really, really hard on it. And I think what Councillor Deeney is proposing and working with Belfast City Council and the enforcement is just going to make us stronger here. And I suppose what we're doing is prevention. If we can look at who's selling these vapes. There are vapes on the market that have 11,000 puffs on them. They should only have between 400 and 600. So that is us protecting our young people by putting these enforcement into the policy around who can sell vapes. So just to say that I hear you, and there's a lot of people asking them questions, where's the support, where's the support? It is coming, and as soon as that link for the landing page in the PHA and any leaflets, posters, anything, I'll bring them to this forum here and you can all have access. So,
Thank you, Councillor Hutton, that's very useful. I had heard and seen some of the reports that Councillor Donnelly's referencing on social media, and as a father of young people myself, it was quite alarming. I had heard reports of it happening in other cities outside of Derry before Halloween, and I was it's a bit strange, and thought it wasn't too long before we're hearing it now in our own city. And I think, as Councillor Donnelly suggesting, if we can get those figures and that data through the PHA, and do whatever we can to try and address it, whilst also supporting parents as well through some of the initiatives that Councillor Hutton has spoken about. But I do think, you know, regulation and enforcement is the key. They trying to tackle this and making sure that those that are either manufacturing or selling vapes are doing it responsibly and legally, and selling it to the right people. And that's one of the ways that as a society we're going to have to try to tackle it. So if we're happy enough to move on from that, I'm going to call Councillor Boggs on item 18, I think it is.
Margaret, Chair, thank you very much. I suppose I first of all want to also comment on the event that Councillor Hutton mentioned at the start of the meeting in relation to the event that was in the Guildhall last week, and the strong messaging that put across when, as you said yourself, Chair, you hear it from real life people that you know and that you recognise, and the stories that they bring forward. So just to commend that event first of all. I suppose I'm trying to link here to the Protect Life 2 action plan and the importance of it, particularly for those 4 areas there at 2.3 and in particular 2.3.4 around the post-pension support for those bereaved. And in relation to that, Chair, I had a meeting with the Mayor on the 25th of January, and also in attendance was Barry and Seamus and Adele from the media team, and I told the Mayor and also the family of Rory Carlin who were at the meeting that I would raise the contents of the meeting, so to speak, at the next Health and Communities Committee meeting, because that was the directive that were asked to attend the meeting. So I think just like that engagement that was in the Guildhall last week, I'm sure that Seamus and Barry would agree that the meeting was hard-hitting and highly emotional, as the family outlined the struggle that they're going through at the minute, but also the campaign that they're leading the charge on in relation to suicide prevention, particular awareness around drugs misuse right across our communities. And I know it's something that we've talked about at this committee before and also at full council, but I just wanted to highlight, Chair, some of the main things that came out of that meeting. And I know that Seamus in particular has actioned some of those already to invite the Quorum Centre and to meet with the next DAC committee meeting. And I spoke to Adrian today from the Quorum Centre, who looks forward to coming to this committee during the special meeting to present themselves in relation to the plans that they have for Strabane Town in particular going forward. And there was also just an ask, Chair, to come back to this committee and propose that anything that we do reflects the feeling out there amongst those families who are suffering a bereavement through suicide, particularly when drugs and alcohol misuse are involved, and that we ask the officer team to be cognizant and aware at all times when we're making policy and delivering on projects, that we try and factor in information and awareness around the impact of drugs and alcohol, particularly on young people. So I want to just at this committee commend the family again for their bravery and their time that they spent with us that day, and also to thank the Mayor for hosting that meeting and the officers that attended. And I suppose another and final ask, Chair, coming from that meeting was to plug an event that the family have organised on the 16th of March, just the weekend of St Patrick's Day, where they will be gathering to climb Mount Errigal that morning. And I know that the Mayor intends to be there herself, and she is also going to advertise that across her own platforms and social media. But it's just to make members of this committee aware that is happening, and ask that once that is on the council website, that members, particularly of the Health and Community Committee, but also of council, give that a push on their own social media to show support for that family, but also for the broader issue and other families who are facing the same situation. So thanks, Chair.
Thank you, Councillor Boggs, for that. Councillor anybody else on this paper? No? No? Okay. Councillor McDade?
Thank you, Chair. And mine is on item 20. So that's on the internal audit of the PCSP. So I'm glad to see just in the report that 17 of the 20 recommendations are already complete and the other 3 are on their way. But I suppose we've already heard in a previous paper about the cuts to PCSP funding. And obviously we've all expressed our massive concerns around this. And today, this evening, just in the last couple of hours, we've talked about suicide 3 times already. And one of the things that was cut with the PCSP funding was the CCTV at the foil. So I think that given that we know that that CCTV has saved lives in the past and it has helped in searches and recovering bodies of people who have died through suicide at the foil or through misadventure, we know the importance of it and we know that we need it. So I am making a proposal that we write to the Department of Justice and ask for that funding to be increased again so that we can reinstate that CCTV. So yes, that's it. Thank you very much.
Just through yourself, Chair. It was actually other partners so it was the PSNI who cut the funding. So they have confirmed it will be in year savings that they will provide towards it. So it's mainly the PSNI that cut the funding for that particular programme.
Can I write the PSNI then? No, assembly as well.
So is that funding going to be reinstated 100%?
No, the members will be aware of the new 5-year contract. There was a lot of capital works. A lot of cameras were old and tired and some of them out of commission. So they have found some slippage monies around capital to carry that out. So council don't have to put all of their monies into that. But the recurrent revenue, there's been no confirmation from any of the providers. We get it year to year. So there was a capital and recurrent revenue cut from that organisation.
Sorry, so can I, does that mean that they're not going to be fixed?
Yep, I'm commenting now as quickly as I can. I've a number of times today, I've allowed people to come back and the questioning officer. I'm doing exactly the same. I've done the exact same with Councillor Devine. It's actually the second time. I've done the same with Councillor Devine around the community building at Victoria Bridge. I'm commenting now as quickly as I can. Councillor McDade.
Just want clarification. So I'm just to understand, is the CCTV going to be fixed or not? Is it, you're saying that we don't know until the PSNI have their funding looked at? Is that right? The slippage? Thank you.
Through yourself, Chair. We have a contract. Council awarded the contract for the CCTV works, the capital and revenue. So we're bound by that contract. So we have to provide a certain amount capital and revenue monies every year. The Executive Office and PSNI have confirmed they will have some slippage monies to provide us to do that. But if those monies weren't available, for example, in year 2 or 3, council would be liable to carry those works out. So we'd have a decision then, do we do that? But all of the cameras that are to be replaced in this financial year are currently being replaced and will be done by the end of the year.
Okay, Councillor Duffy.
Thank you very much, Chair, for allowing me in. As the chair of the PCSP last year, I met with the Assistant Chief Constable Bobby Singleton in relation to this very issue. There was discrepancies in relation to how the CCTV here in the city was funded and discrepancies with how it was being funded in other areas. So whilst they cut the funding for us here, they were continuing to fund in other areas. So at that stage, Assistant Chief Constable Bobby Singleton went away and was able to find the money for this year. At our last PCSP meeting, we have again written to the police and demand that continues for this year as well, because it is continuing for other areas. So it needs to continue for here. And there's a recognition that it's not just a crime element, that it is a complete vulnerability element along the riverfront and along our city centre. The police service locally have acknowledged that and will continue to lobby on the behalf of the city and district as well, because there is a complete recognition that that money needs to continue to come into the city. I believe that the willingness is there. It's just finding the pot. But the current issue with the cameras and the maintenance, my belief is that the money last year that was secured is going to continue to fix those cameras and upgrade the ones that needed to be upgraded. Thank you.
Thank you for that, Councillor Duffy. I have no further indicated speakers on open for information. So I'm going to propose that we go on to confidential. Yep, Councillor Hutton and Councillor Bar.